So here we have Joe finished his procedure, had his heart catheterization, and we're going to ask him a few questions because, as we mentioned earlier, we want that fear about the heart catheterization to go away from the people. So Joe is just an example, and it's a real patient who is going to tell you his experience about how did the procedure go. Hi, Joe.
Hi.
So you had your heart cath.
Yes, I did.
I'm going to let you speak and tell us exactly how was it and how is everything went.
Okay, I came into the cath lab and there was 4 or 5 ladies that asked me a whole bunch of questions, slid me over on the bed, and the one lady told me, I'm going to give you something to relax you, and which it did. It relaxed me. And as I was laying there, I was getting relaxed, and then you came in and did the heart cath. And then after you did the heart cath, I laid there for a few more minutes, and they unhooked me and they took me out, and it probably lasted a half hour or less.
Did you have any chest pain during the procedure, any major symptoms?
No, I didn't feel a thing.
Because heart catheterization, when we do an angioplasty, the patient could experience some symptoms during the procedure. So we always ask the patient, how does he feel? Is there any chest pain, trouble breathing, confusion? We ask them sometimes to move their arms and their hands to be sure that they are not having any major complication from this procedure. So Joe, after he had the heart catheterization, we made the determination that he has a few blockages and he is going to require a stent. So did we talk to you, Joe, and told you that you're going to have a stent?
Yes, I was.
And you were already consented for that if there's
Right.
any blockages, we're going to proceed with a stent, right?
Correct, yes. Yes.
Now, after we are done, did we do any, did we put a sandbag on your groin and we told you you're going to stay
No,
lying down?
You put a plug in my groin, and then I went out to recovery, and they gave me some meds, and then I went back up to my room.
So within 1 hour, you're done.
Yeah.
You
yeah.
are able to walk and you're feeling good, no problem, no bleeding.
Nope,
This is
nothing.
the advancement in the heart catheterization. Most of the patients, they used to be lying down on their back for about 8 to 10 hours. And it's really depends on how much pressure we put on the groin, and the complication of hematomas and bleeding was much higher than what we have these days with using these plugs, which is a simple procedure. We use it in most of the interventional procedure, and Joe is one of the example. The reason we are concerned about that because of the blood thinner. You know, when we do an angioplasty stent, we use a blood thinner, and that's one of the example here for Joe. Joe, how you feel right now about going home?
Great.
Good.
I'm ready to go. I've been ready.
Now, was it the procedure that fearful, that complicated? Were you concerned about it?
No.
Is that because you had it before? Was it like the first time, or it was a little
No.
bit different?
Because even the first time I had it, I wasn't too concerned about it.
Good.
Because I knew I was in great hands, so it made me feel good.
But other than being in great hand, is it because we informed you about what to expect and you got enough information about the procedure?
Yes, everybody explained the procedure very well to me.
Good. And that's really our goal, is to educate everybody about heart catheterization and how we're going to do it, and to get that fear out of your mind.
New medicines, new procedures. The more complicated healthcare gets, the more you need a special kind of expert at your side. Sure, Mercy physicians are leaders in using the newest medical technology, but something just as important never changes. A commitment to listening, to understanding, to finding the best option for you. The choice to be in expert caring hands? Choose a Mercy physician. Find yours at mercyweb.org/doctors.
Is your heart clock ticking? It's time to change your future with Toledo Cardiology Consultants.
Up to 8% of pregnant women get hypertension, which can be extremely dangerous for mom and baby. It's increasing as women are getting heavier and have babies later. Gestational hypertension usually happens after the 20th week. So work with your doctor to keep close watch of your blood pressure.
Go to WTOL.com, Health Track.
Because time waits for no one.
A warm hunting cabin, a tent pitched on the lake, the Maumee River packed with fishermen. I'm Matt Markey, and this is My Outdoors. We'll look under the water in Lake Erie and in our many rivers and streams. We'll turn over a few rocks in the fossil park in Sylvania. We'll watch eagles nesting, hawks hunting, and ducks and geese filling the sky. There's no limit to what we can see and experience in the outdoors, and we'll investigate it all. I'm Matt Markey, Tuesday, Friday, and Sunday in the Blade.
Welcome back. Now, I hope after all of this information we provided you, we took the fear out of your mind about the heart catheterization. As we explained, it's a simple procedure. It doesn't take that much. At the same time, your doctor usually confident to explain everything to you, how it's done from A to Z. You need to think about the heart catheterization is becoming a standard test to improve the outcome of patients, especially if it's needed. But the most important thing is the patient himself. You need to remember, if you start having symptoms, if you're having a chest pain, if you're having trouble breathing, shoulder pain, jaw pain, you need to talk to your family doctor, who will be the captain to decide where to go from there. He should do the EKGs, he will order some testing for you, including stress test and echocardiogram and all of the tests which could help to decide about the future management for you. The bottom line, if your doctor tells you that you need a heart catheterization, don't be afraid. It's a simple procedure. All of the facilities which does this in our area are very equipped, very trained, and they are ready to do this procedure in a very easy way. I hope we took that fear out of your mind. Now, after we did the heart catheterization and we informed you about what we find, if you have some minimal blockages or a serious blockage, whatever is the treatment, it's going to be the most important step, how to prevent yourself from coming back to the cath lab. You need to remember, we always discuss it in some of the spots we introduced to you before about the diet. You don't have to eat cheeseburger and say that I have a cholesterol medicine in that pill. Do you remember that cheeseburger, we throw it in the garbage? That's one. When you are ordering your pizza, you need to order the one which is healthier, less calories, less cheese, order more veggie. It's so important to do that. The next step is to discuss with your doctor, for example, about your aspirin, how necessary to do the aspirin for every patient who is older than 55 years old age. The other thing is to remember about exercise. That's what we need to promote. Exercise is so important because it will help to keep your blood pressure under control, your cholesterol under control. At the same time, if you are diabetic, will bring it down. And the chance of having a heart problem in the people who exercise on a regular basis is much, much, much less. The bottom line, remember how to take care of yourself. Don't wait until you have the heart catheterization. You can prevent yourself from having a heart catheterization. So in that case, the fear will not enter your mind, period. Try to exercise, eat healthy, take care of yourself, take care of your mom, take care of your kids. That's really the most important thing. Thank you. This was the first premiere show for this program, and I hope you enjoyed it, and I hope we are in this journey together. Our goal is to educate you and prepare you to be aware of all of the problem and medical issues and go ready to your doctor to discuss it with him in a better understanding and a better informative way. In the next few shows, which is we're going to present in the next few months, we are going to talk about multiple medical issues, not only heart disease. We're going to talk about delivering baby. We are going to talk about infectious disease. But probably also we're going to concentrate on the most advanced technology in medicine. We're going to talk about doing the heart surgery without surgery. We're going to talk about robotic surgery. We're going to talk about treatment of new antibiotic and new cholesterol medication and new blood thinner, which is really going to improve our life together. Again, we go back and we hope that we all of us follow the instruction and discuss it with our doctors. Because remember, I always say, time waits for no one.